Welcome, everybody. This is a segment of the WID, World Institute on Disabilities Policy Summit, and this particular segment is on Social Security and Social Security reform around the definition of disability and the employment picture for people with disabilities today. I am Brian McDonald, and I'm the Program Director for the Employment and Disability Benefits Initiative at the World Institute of Disability, and I'm joined by Neil Jacobson, who heads up the CareerACCESS initiative. And Neil is going to kick us off with his presentation. Welcome, Neil.
Exploring an alternative definition of disability. Barbara Butts, Anita Aaron, Aya Gabi, and I recently submitted a paper entitled Exploring an Alternative Definition of Disability to the Committee for a Responsible Federal Budget. Today, I want to tell you about the recommendations we made in that paper. Before doing that, I want to start by telling you a little about me because I think it's relevant to our paper. In 2008, after 29 years of working for Wells Fargo as a disabled IT professional, I retired as a senior vice president to start a disability-focused employment company that specializes in consulting on staffing and placement issues. While at Wells Fargo, the project I am most proud of was the one where I designed and was responsible for the first 7x24 online banking system in the United States. My disability has always been very visible. I use a powered wheelchair. My speech has always been impaired. I use personal assistant services for many of my activities of daily living. In the 70s, shortly after starting work, I received a letter from Social Security telling me I was no longer disabled. My friends quickly reassured me that I need not go through an identity crisis. My cerebral palsy remained intact. It took me over 5 years to earn as much working as when I received government benefits. If I had needed as much assistance then as I do now, I could not have afforded to have gone to work. Changing the Social Security definition of disability is not a new idea. Our research revealed that in the 1950s the founders of the Social Security Disability Program wrestled with the definition. The wrestling has continued for 6 decades. In 2006, the Social Security Advisory Board emphatically recommended the definition be changed. We suggest the new definition be, a disability is a medically determinable physical or mental impairment that has resulted in a substantial impediment to employment and is expected to result in death, or has lasted or is expected to last for a continuous period of at least 12 months. This definition is very similar to the current definition, except there is no reference to the ability or inability to earn above the substantial gainful activity (SGA) amount. With this new definition, the Social Security Disability Program can and should restructure itself. The restructured disability program should enable and encourage people with disabilities to seek assistance to stay at work as soon as impediments to employment due to disability appear. Hopefully, the concept of going out on disability will be eliminated. The newly structured Social Security Disability Program should put focus on coordinated employment services and must be much simpler to navigate than today's program. This definition will enable Social Security to set up a 2-phase approach. Phase 1 enables beneficiaries to receive support services. People with disabilities should be eligible for Phase 1 if they have the required number of Social Security work credits and if they have a disability as newly defined, and as soon as their disability imposes impediments to their employment. Phase 1 beneficiaries receive health care services and coordinated employment services as needed. People remain eligible for Phase 1 support services until they reach retirement age, or are no longer disabled, or no longer need or want support services, or die. Phase 2 enables beneficiaries to receive cash benefits. To be eligible for Phase 2, people with disabilities must be eligible for Phase 1. To begin receiving cash benefits, and to avoid induced entry, applicants should be expected to earn below a given wage for a given amount of time. These cash benefits should be viewed as offsets to the high cost of disability. Our paper refers to studies documenting that the cost of disability is high. You can also take it from me. Having a disability is expensive. We recognize the need for an upper earnings limit above which beneficiaries should be able to pay their own expenses. We suggest SSDI beneficiaries keep their full cash benefit until their total earnings, plus stipend, exceed 250% of the federal poverty level. After reaching that earning level, stipends will be reduced by $1 for every $3 earned. Earnings will be reevaluated annually. Participants experiencing intermittent unemployment can request earnings reevaluations more frequently. The emphasis of the restructured SSDI program should be on providing coordinated employment services. Professional career coaches should work with beneficiaries to create, monitor, and maintain their individualized career plan, ICP. ICPs should clearly outline tasks to be accomplished to stay at work or return to work. Tasks may include completing a rehabilitation program, finishing a school, training or retraining program, assessing and modifying the workplace environment, obtaining benefit and financial planning services, acquiring self-employment and business startup services. There are many employment services available to people with disabilities today. We are not suggesting new services need to be developed. Today, however, there is a very complicated maze that people with disabilities must go through to find, qualify for, and take advantage of these services. There is a dire need for beneficiaries to work with career coaches to coordinate services. Social Security should take the lead and fund the full development and piloting of the restructured program, including coordinated employment services. Social Security should administer coordinated employment services, outsourcing the work to local agencies. Social Security should also evaluate the effectiveness of pilots and modify the program as needed. In the development stage, a complete definition of coordinated employment services as well as the roles and responsibilities of career coaches must be agreed upon. How individualized career plans will be created, monitored, and maintained must also be decided. Consensus and cooperation from affected government agencies, the vocational rehabilitation community, the disability advocacy community, and the employer community must be obtained. In the development stage, federal waivers must be obtained and a cost-benefit analysis must be conducted. This analysis must determine what % of beneficiaries must stay at work/return to work to ensure the program will be financially sustainable. The program should be piloted in 3 to 5 states. A complete evaluation should occur after the first 5 years and every 3 years thereafter. The program should be modified as lessons are learned from the evaluations. The proposed new definition of disability for Social Security and the related proposed changes for SSDI are a result of the work we've been doing on a program called CareerACCESS. Brian will be describing CareerACCESS. One of the most important things I've learned in my professional career and from being a person with a disability is that if you don't start, you will certainly never succeed, and you must always go, go, go.
Okay.
All righty. Switching over.
Yeah.
Okay. If I could just pass the laptop over a little bit. Thank you. So that we have Brian McDonald again, so that we have a goodly amount of time for some Q&A, because this topic is rich with discussion. And once you open the Pandora's box of Social Security reform and employment of people with disabilities, there are more questions and comments and discussion and points of view than you can shake a stick at. So I am going to be sort of a helicopter ride over the SSI focus that the CareerACCESS project has also taken on and developed actually over a 3-year period. Neil's presentation to date and the overview he gave you is focused on the SSDI population, which is the insured worker in the Social Security benefit system. They are older, they have a work history, and we have evolved and developed a framework for very systemic framework for addressing similar and/or the same needs, but to the SSI population who is 18 to 30. This is a different population than the SSDI population. However, I'm going to, and again, in the interest of time, I've just got one slide up on the screen with a series of questions. And I'm kind of going to ad-lib and give you a high-level overview of what the SSI CareerACCESS project is to date and how we've gotten to where we are today. Why career access for an SSI youth, young adult population? The essential answer to that question is that the employment rates in the SSI population and the SSDI population are plummeting. Plummeting. Social Security Commissioner David Weaver testified to Congress in June of this year, presented 5 pages worth of tables about how less and less people are earning money who are on his programming, the disability programs in Social Security. We are at a crisis stage in terms of interventions today and work incentives today not working. So that's essentially why career access. What we envision in the SSI world, which is a means-tested program, is setting up pilots in 3 to 5 states. And I'm going to end with a bit of an update on Michigan, which is leading the pack right now in terms of state officials and disability organizations across the state of Michigan who are interested in being a pilot project state. The goal of the pilot project is definitively to offer a substantive alternative to applying for SSI as we know it and loathe it today if you're 18 or older. The current SSI youth who apply, or young adult who applies for SSI, who is 18, 19, 20, 21, must show Social Security they cannot work, and they have a medical disability that is the culprit, that is the reason for the inability to work. We get rid of that inability to work test, and we offer the Career Access Pilot Project in 3 to 5 states as the default program. So if you're applying for SSI in a pilot project state, you're actually going to be applying for the default program, the Career Access Program, and not the current SSI program, which is requiring you to prove you can't work to get a benefit. If you find and you feel that you're not ready for career access because it has some responsibilities towards creating a career, you have a choice of making a choice, which you don't have today, of applying for the existing SSI program. But you have to make that choice. The default program is Career Access. The Career Access Program writ large, or to sort of sum up its main elements, there are programs funded by Medicaid across the country and with home and community-based waivers with a construct or a policy framework of cash and counseling. Well, Career Access is very much about cash and counseling. We offer a career coach set of services where there is a person who works for the person enrolled, not for voc rehab, not for the developmental disabilities world, but works for the career access client who is enrolled, brokering and finding services that help build career. The enrollee must develop an individual career plan. We want them to get started on that within 90 days of enrollment. They need to make progress on the individual career plan with the services of the coach, with the availability of current existing funded programs like voc rehab. So we want to braid and blend existing funding streams into the Career Access Pilot Project with what is arguably a new funded service called the Career Coach. With the services comes an enhanced SSI cash benefit, very similar to the model that Neil outlined in the SSDI proposal. It just so happens, lucky us, in the SSI world, there is the student earned income exclusion. What we propose in the SSI pilot projects is offering the current SSI student earned income exclusion for anyone who's enrolled in the Career Access Pilot Project up to the age of 30. So we expand an existing policy precedent, and the numbers actually crunch similar to the numbers that you saw on the screen for the SSDI population. So it's an enriched career access cash stipend from Social Security for those who are using those funds as part of their career planning. So it's a cash and counseling approach which has precedent in programming for Medicaid. The dynamics of getting that off the ground are twofold, and we are working hard on progress on both fronts. One is that we need federal waivers to bend the current rules so that a pilot project could get underway with these new set of rules that we would test in 3 to 5 states. And we need a set of appropriated funding from the federal government to pay for the extra services that would be involved in a pilot project state. So those are the two main policy hurdles that we're about right now. And we need more help. We need your help. And as Marcia said with her segment, we hope that you will enjoy the overview that you're hearing today from Neil and I both, and share this video on YouTube and all those other good social media things. The last thing I want to suggest to all of you, the single portal where you can get more information on the Career Access Initiative is simply ourcareeraccess.org. All one word, ourcareeraccess.org. And with that, I'm going to keep it simple, as they say, so that we have some time here for Q&A. So don't be bashful, this is Berkeley. Comments? Clarifying comments? Questions?
I think these are fantastic proposals, and are you getting any pushback or resistance? And what does that look like?
My approach to that question would be, it's not so much pushback that we're getting, but we're not getting the fuse lit, to be honest with you. The Career Access team met in Washington in July, and some of the young adults who represent Career Access are in Washington right now presenting on Career Access. We have explained and gotten people to nod their heads and agree that these are great policy goals, these are sound frameworks, but we haven't found the champion inside government agencies and or Capitol Hill that are ready to lead the fray and jump in and help get the hard work done. Michigan is leading the pack, however, and with the work that WID has done in states for decades now, innovation at the state level around employment and benefits has really been leading the federal government as far as our experience goes. And Michigan, because of their work with WID, with Disability Benefits 101, they have our website there for our beneficiaries going back to work. There is a network of independent living centers, the Association of Independent Living Centers, and state officials across a range of government, including Medicaid and Voc Rehab, who have met several times in all-day in-person meetings, and are very interested in being a pilot project state, although at this point it is not an official sign-off from the governor's office, but it would probably not be hard to get that at this point in the state of Michigan. They are really leading the pack in organized discussions to be a pilot project state. There are discussions like that going on in California, Vermont, Wisconsin, Massachusetts. There's a number of other states that are not quite as advanced as Michigan, but the interest in wanting to take the next steps has been coming from the states and not from the Beltway.
Yeah.
Yes.
Brian, you're talking about Michigan.
Wait.
The advocates in Michigan.
We need the mic.
This is Loretta on WID staff. I'm very anxious to hear about Michigan a little bit more. You have advocates in Michigan at the state level. Are they willing to go to their congressional delegation on behalf of the program?
Yes.
And get buy-in from the senators and the congressmen?
Great question. This is, and it's a great strategy. And this has already begun. The National Council on Independent Living at the annual conference, the 25th anniversary of the ADA, the NICL members went to 13 of their 16-member delegation and educated them and on the framework of the Career Access pilot projects for SSI young adults. So that process has begun. And I might want to point out, Sandy Levin is the Democrat from Michigan, who is the ranking member of House Ways and Means, and they are a committee of jurisdiction. That could help us. In the back there, with the mic.
David Fazio, are you familiar with and connected with respectability?
We are, with Jennifer
Yeah.
and her group and her ever-growing staff.
Yes,
We are.
exactly.
Yes,
Because-
they are quite familiar. They have materials on CareerACCESS. They haven't formally worked with us, but they are very supportive. They have the materials. They've expressed interest in it.
Yeah, 'cause I know that stuff
Yeah.
that's really important to her. And also, can this even happen if a state approved, like let's say California decides to be a pilot state without federal action, can that even happen because it's on the federal level, right?
Well, as Neil likes to say, the reform initiatives, the frameworks that we've evolved over the last 3 years shake the tree. These are not marginal reform efforts. These are systemic reform efforts that shake the current foundation of these programs, which are legally restricted to people who demonstrate they cannot work. When you go to that level of fundamental change, we have to have federal authority and waivers and or changes of legislation, we don't know which at this point, to be honest, to have a cash stipend program with blended services alongside and parallel to the current programs. And, you know, let's see who wins at the end of the day.
Just one more real quick thing. The plan for achieving self-support, past plans and things like that, to me that seems like the most streamlined, easiest way to get this done, making that mandatory basically or available to everybody automatically once they get approved for these benefits, since that's a program that's already in place anyway. Have you
The
tried?
principles of the plan for achieving self-support are identical to the CareerACCESS project. Social Security has a not so magic way of implementing programs that don't parallel the principles of the program.
Right.
So it is a program mired in bureaucracy and restrictive rulemaking and authority. We have about 1,000, maybe 1,500 people in the entire country with an approved PASS plan. Okay, so that should tell you something about the current use of the PASS program, and a part of the dynamics of that is how complicated it is to get one approved.
Right, I was just wondering if that would be an easier, more streamlined approach to just make that more.
The policy principles behind the plan for achieving self-support, where the Social Security Administration says if you set money aside and you spend it on a vocational goal, we're not going to count it. Well, that's an admirable policy principle, but Social Security's application of its work incentives, quite frankly, is part of the problem. Other comments?
Hi, my name's Antoinette. I used to work with Neil, so I'm so happy to see you today. What I want to know is the difference between SSI and the SSDI candidates. Is it just the age factor?
No. The SSI recipient, and we don't change that in terms of the pilot projects, the SSI recipient is a person with the same medical level of severity of impairment. So the medical rules for both SSI and SSDI are the same, no matter what your age. But the SSI population has little or no work history, has not paid FICA taxes because they haven't had a work history to pay into FICA taxes. So they're not insured. They are de facto low income, and they have to be low asset as well.
Okay.
So they don't have a work history, and by and large, they're younger
Yeah.
than the SSDI population. The average award for SSDI is 50. And as you know, there are about, I think, 1.2 million SSI recipients who are under the age of 18 across the country.
Hi. I remember talking with Neil about this project back when it was first a figment of his imagination. And one of the, at the time, the way I understood it is he was thinking of proposing that this be, the CareerACCESS be mandatory for people receiving SSI. And he was anticipating a huge blowback from parents. And I'm wondering if by these limitations on the age and also by having the option of staying the same, if that blowback has gone away, or what kind of reaction have you been getting from families?
The pilots are testing a shake the tree framework, but Ann, you really bring up an important point that we got into the weeds in Michigan with these in-person meetings. There is a really well thought through do no harm aspect to the SSI pilot project. Not every 18-year-old is ready to jump up and get a career and managing a significant disability. So the default program is, as is the policy in employment first states, that services should be geared towards employment, building a career. But if you're not ready for that, the SSI program as it exists today is still available to you. But that's a choice that the 18-year-old doesn't have today. The SSI is the only door in town, and that's the problem that I think we address in a do no harm modality.
Brian and Neil, for the Career Access Initiative and the coalition building, I know you've gotten or not gotten enough response from the Beltway. Have you approached the business community, the Chamber of Commerce, large stakeholders who might be supporters of this, like Walmart, for example, where you could garner some influential support for the initiative?
Well, Neil is not to directly answer your question, but Neil is working with community development organizations in a fundraising effort to gather fundraising support for these design phases of what we're going through. But directly to employers and maybe their foundation wings and such, at the moment, I don't think we have. Good idea.
Yeah, that's a good idea.
Yeah.
That is a good idea.
Thank you.
Okay,
Other comments?
okay, go.
OurCareerAccess.org. That's up on the screen. Thank you.